Hi, my name is Madison, and I'm with the University of Oklahoma with the Health Science Center as the Duo for Health coordinator. Today, I'm going to be talking about enhancing nutritional counseling in healthcare and the impact of the Duo for Health program. So, what we know in Oklahoma is less than 5% of adults with diabetes and hypertension are meeting the minimum guidelines for fruit and vegetable access. These also show that adults view their physicians as trusted sources of nutritional information. However, fewer than half of those individuals with diabetes and one-third of those with hypertension are receiving any formal counseling about dietary strategies to manage these conditions. We know by research that fruit and vegetable access and availability is extremely important for therapeutic properties to help manage these conditions. However, those individuals who are on food stamps or supplemental nutritional assistance program, otherwise known as SNAP, may not be able to afford these products. This is where Double Up Oklahoma comes along. Double Up Oklahoma provides nutritional incentives to buy free fruits and vegetables for locations all across Oklahoma, including grocery stores and farmers markets. And Duo for Health adds a secondary impact with that by partnering with healthcare providers to provide these incentives as well as providing dietary counseling through recipe cards and cooking method cards to give out to their patients. Over 20 different active Duo for Health clinics exist throughout Oklahoma and are currently expanding, as you can see by this map. Enrollment includes signing up for these as well as quarterly surveys where we evaluate with 40 different providers currently how they have their overall satisfaction with the program materials, as well as perceived patient interest in materials, and to what extent the program materials have affected the ability and the frequency to give dietary advice by providers. We've given out almost 10,000 brochures and 12,000 recipe cards over to patients and providers throughout this program, so it's had a great impact so far. So among those providers, 20 completed at least one quarterly survey, and they've showed that 60% showed that there's an increased frequency in dietary advice and an increased confidence in dietary advice. They've also said that there's perceived interest among the patient population for the brochures, recipe cards, and cooking tools, those orange peelers. Findings suggest that Duo for Health providers feel more confident in delivering dietary advice when given these materials, as well as they may encourage participation with patients with the Double Up Oklahoma program, providing them with free resources to fruits and vegetables. Lastly, future direction for this program is to examine the influence of Duo for Health on a patient-centered side, since we're only able to talk about providers and those community health workers today. Thank you so much. If you have any questions, let me know at the conference. Thank you.